There's a good chance you've heard about the drug Ozempic in recent weeks. The diabetes and obesity medication, also sold as Wegovy, has been making headlines as many social media influencers credit the injections as a quick fix for weight loss, which has also prompted speculation surrounding celebrities who've slimmed down dramatically. The obsession comes as fashion trends and runway styles seem to revert back to the so-called heroin chic, stick-thin ideals of the late 1990s and early 2000s. And doctors are warning that the flood of demand for this medication is causing a serious shortage for people who really need it. And American demand has prompted officials in British Columbia, Canada, to restrict how much Ozempic can be sold to people outside of the country after discovering an alarming percent of the province's sales of the drug went to American residents. So while the body positivity movement has made strides, it appears it's one step forward, two steps back with the ceaseless commentary on celebrities' bodies. As journalist Kelsey Weekman wrote for BuzzFeed News, quote, "For every TikToker wearing whatever she wants, there's a post ridiculing a celebrity for not choosing something flattering." Well, Kelsey joins me now. She's a reporter, again, at BuzzFeed News, along with Dr. Fatima Cody Stanford, an obesity medicine physician scientist at Mass General Hospital. Welcome, ladies.
Thank you.
So, Kelsey, I cannot scroll through my social media without someone mentioning the Ozempic diet, how skinny the Kardashians are. And I just think of all of the hard work we did in the 90s and early 2000s so that the next generation could wear high-waisted pants and love their bodies. It just feels like a throwaway.
It certainly does seem like we're going backwards in terms of body acceptance and body positivity. It's been all over my feed as well. I can't log on to social media without seeing someone talk about Ozempic, talk about weight loss, use weight loss as a way to critique someone's body size. It's everywhere.
So when you're writing, these articles talking about celebrities, I'm thinking of the Oscars, right? There are tons of jokes about that kind of thing. What are some things that you were seeing in terms of the coverage of these celebrities thinning out, slimming down, and, basically, wink, wink, it is attributed to Ozempic?
So celebrities are always kind of in that space where people are looking at them, and because they have such a big footprint, people are able to easily compare what they used to look like to what they did now. And recently, media has become extremely fixated on certain celebrities or, certain types of celebrities that are starting to look a little bit different. Mindy Kaling is an example. She recently slimmed down quite a bit. People asked if she was using weight loss drugs and she denied it, but that focus is again just on her body. And when a celebrity loses weight like that, it often becomes what they're known for. Celebrities like Adele and Oprah in the past have lost a lot of weight, and that has just been so many headlines involving them, even though they do so much more. But we're just seeing this as the reason why a lot of celebrities are being talked about.
Dr. Stanford, as I read more about this drug and folks using it, the ease of access to it was what was surprising to me. There was a report in the New Yorker of a reporter just being able to put in fake, BMI numbers and get it and be marketed to that way. And then we just heard that example out of Canada where they've had to crack down on folks getting it. It seems like people are easily able to access this drug.
It's very frustrating for me that actually cares for patients that have the disease of obesity to have it such that my patients that actually, would benefit from these medications because of their obesity and other chronic diseases not being able to get access to it. And then those that don't really seem to have any indications for these medications being able to get it with relative ease. I can tell you all of 2022 for my patients that were on these medications or trying to, get on these medications that had the appropriate indications, I wasn't able to get it for 6 to 9 months for most of my patients. As an obesity medicine physician, you can't get in to see me unless you have obesity and chronic disease. But yet those people couldn't get it sounds like a lot of people, were able to, and that's problematic, right? This is not a vanity drug. It's being utilized as such. If and then this medication is needed for a person, this is a long-term sustained use that's needed for these medications for the chronic treatment of diseases like obesity and type 2 diabetes. But what I'm hearing is not that story, and that's problematic when we think about this in the context of treating patients that actually have illness and disease and could warrant and benefit from these for the actual treatment of their disease process.
For folks who don't know what this drug physically does to your body, talk to us about that.
Absolutely. So there are two primary pathways of the brain that regulate weight, and these medications, the GLP-1 receptor agonists, and these medications stand for, or the GLP-1 is glucagon-like peptide 1 receptor agonists. They act on stimulating the pathway of your brain that tells you to eat less and store less. That's called the POMC, or the pro-opiomelanocortin pathway of the brain, while inhibiting or blocking the AGRP pathway, which is the agouti-related peptide pathway, which tells us to eat more and store more. So the reason why people are flocking to this is because when they take it, they do notice tangible differences in their desires, their satiety, which is that sense of fullness, their hunger in between meals, because it's working on that primary biology that regulates food intake within the hypothalamus of our brains.
And so this is a drug you have to take for the rest of your life in order to sustain this weight loss that you would have on the drug.
Absolutely. So Wilding and colleagues, Wilding was the person that published the major study that came out in the New England Journal in 2021 when this medication was first approved for the treatment of obesity. And he published a subsequent study that looked at withdrawal of the medication and what happens to individuals in terms of weight gain, weight loss, et cetera. And what he saw was exactly what we would have anticipated, that when we're no longer acting on those pathways of the brain, people will regain what they lost. And so that's what we anticipate. When you're playing around with these, weight cycling, going, on these just to look cute for the Oscars or for South Beach or whatever you're trying to look good for, that's not the way that we should be using these. These are medications that are used to act on the brain to change the likelihood of death, and it reduces the likelihood of stroke, heart attack, and admissions for heart failure, for example. But that's not what it sounds like these are being used for in the context of celebrities that are just using these to look cute for a nice outfit for the Oscars.
Well, Kelsey, I mean, that's the part that's not on the TikTok, right? Like, and although I think, maybe a handful of influencers that were early adopters of it has spoken out against it, but you're not really hearing those voices in the chorus of folks who are suspected Ozempic users.
That's right. It's really the people who want to drop a quick dress size just to look slightly thinner than they did before. It's people who are unfortunately caving into that societal pressure of being just as small as possible, not necessarily health related. And people are noticing, people are calling it out. And sometimes that's good, sometimes it's okay, and sometimes it's shameful and it feels really bad.
Well, one thing about popular culture is that the pendulum always swings and swings sharply in one direction or another. And I'm thoughtful about what happens when curvy is back in.
Right. I mean, it's possible that, people will start tampering with their health in other ways. I think that thin in some way has always been in, especially for celebrities. But I think that eventually the pendulum, like you said, will swing back, and that heroin chic won't be the most desired look, and people will be rethinking the things that they did to their bodies to achieve a look that isn't something that is going to last a lifetime for them.
And Dr. Sanford, I imagine you're hoping the trend goes back the other way so that your patients can have access to this life-saving medicine. One thing I noticed was, I mentioned you have to take it for a lifetime. Folks who are type 2 diabetics have to take insulin for a lifetime as well. And I'm sure that they would much rather be dealing with a drug that will allow them, better health overall.
Right. Right. I think of this from a health perspective, and I think that's really important. I can tell you one of the reasons why I never comment on my patients and their weight and their size is because that's not what brings them value. What brings them value is their overall health and whatever other contributions they're making. But what we do know is this idea of weight bias and stigma shows up super early in life. The lecture actually I just gave today was about this issue. We begin to demonstrate tremendous signs of weight bias at only 32 months of age. I didn't say 32 years old, 32 months of age. And when I say that to parents, they are like, oh, I never say anything negative about people that are of size. And I'm like, but what are you not saying? Are you only commenting positively on people that are lean? And so people, i.e. your children, are picking up on the fact that that's more desirable because that's what mommy and daddy talk about. Those are the nonverbal cues that they're receiving that shape how they interact with the world. And so when Kelsey talks about this thin ideal being kind of the status quo for all of us for most of our time, even if the pendulum swings back, still that thin leanness is desired, whether achieved in healthy or unhealthy ways, and that is problematic.
Absolutely. Well, Dr. Fatima Cody Stanford and Kelsey Weekman, thank you so much for your time.
Thank you.
Thank you.